Louisiana Health warns, flesh-eating bacteria cases surge in 2025. Imagine a microscopic threat lurking in warm coastal waters, one that could turn a simple swim into a life-threatening ordeal. That's exactly what's happening in Louisiana right now. The Louisiana Department of Health, LDH, has issued a stark warning. Cases of Vibrio vulnificus, a bacterium often dubbed the flesh-eating pathogen, are spiking at alarming rates. This year alone, 17 infections have been reported, with 4 fatal outcomes. To put that into perspective, over the past decade, Louisiana averaged just 7 cases and 1 death annually during the same time frame. And here's where it gets controversial. Is this surge a natural fluctuation, or are warmer ocean temperatures and climate change fueling a new public health crisis? Let's break it down. Vibrio vulnificus thrives in brackish or saltwater, especially during the warmer months of May to October. It can enter the body through open wounds, like a sunburn, cut, or scrape, when someone swims in contaminated water. Even more concerning, the bacteria can be ingested through raw or undercooked seafood, particularly oysters. This is the part most people miss. 75% of this year's cases were linked to wound exposure, not foodborne transmission. That means a single splash in the water with an unnoticed scrape could be enough to invite infection. The risks aren't equal for everyone. High-risk groups include individuals with liver disease, diabetes, HIV, or those undergoing immune-suppressing treatments. Even something as routine as acid-reducing medications or recent stomach surgery can increase vulnerability. Symptoms vary. Gastrointestinal issues like diarrhea and fever, wound infections marked by swelling and redness, or severe systemic infections causing dangerously low blood pressure and blistering skin lesions. But here's the twist. Many dismiss early symptoms as a mild bug or sunburn, delaying treatment until it's too late. LDH's advice is clear but critical. Cover wounds with waterproof bandages before entering coastal waters. If you've been in the water with an open cut, wash the area thoroughly with soap and water immediately. When handling raw seafood, use gloves and avoid cross-contamination with cooked food. For high-risk individuals, extra precautions like protective clothing and avoiding raw shellfish altogether could be life-saving. Now, here's a question to spark debate. Should coastal states mandate public health campaigns about Vibrio risks, similar to warnings for red tide or jellyfish stings? Or is it up to individuals to stay informed? Share your thoughts in the comments below. After all, awareness might be the first and best line of defense against this invisible enemy. Deadly flesh-eating bacteria outbreak in Louisiana. 4 deaths in 2025. 4 lives lost to a hidden menace lurking in coastal waters and raw seafood. This is the grim reality of Vibrio vulnificus, a flesh-eating bacteria that's making headlines in Louisiana and Florida. But here's where it gets controversial. Why are cases spiking now, and are we doing enough to protect vulnerable communities? Let's break it down. In 2025, Louisiana health officials have confirmed 17 cases of Vibrio vulnificus infections with 4 fatalities. That's a staggering jump from the state's historical average of just 7 cases and 1 death annually during the same period. Florida isn't faring much better, reporting 13 infections and 4 deaths so far this year. These numbers aren't just statistics. They're a wake-up call. So, how does this bacteria strike? Vibrio thrives in warm coastal waters and raw seafood, particularly oysters. The CDC warns that even a minor cut or scrape can become a gateway for infection if exposed to seawater or contaminated food. And this is the part most people miss. You don't have to be swimming to be at risk. Handling raw shellfish with a small wound, like while cooking, can lead to severe, life-threatening infections. Who's most vulnerable? While anyone can be affected, the danger is far greater for those with chronic conditions like liver disease, diabetes, or weakened immune systems. For these individuals, a simple infection can escalate to blistering skin lesions, sepsis, or even amputation within hours. The CDC reports that 20% of Vibrio vulnificus infections are fatal, often within 48 hours of symptoms appearing. But here's the tricky part. Prevention is straightforward, yet overlooked. Health experts emphasize these steps. Cover open wounds with waterproof bandages before entering coastal waters. Thoroughly clean any cuts exposed to seawater or raw seafood. Wear gloves when handling shellfish, even at home. Avoid eating raw or undercooked oysters, especially if you're in a high-risk group. Wash hands rigorously after handling seafood. Still, questions linger. Is the public being adequately informed about this growing threat? Are current prevention measures enough to curb the rising cases? Share your thoughts in the comments. Do you think more needs to be done to raise awareness? Or are these outbreaks a natural consequence of climate change and warmer waters? For more details, visit the CDC's Vibrio page or explore state-specific resources from Louisiana and Florida health departments. Stay informed, stay safe, and remember, a little caution can mean the difference between life and death when it comes to this silent killer. Flesh-eating bacteria. 32 cases and 8 deaths in Gulf Coast states. A day at the beach could turn deadly, and it has nothing to do with sharks or riptides. A terrifying, naturally occurring bacteria is thriving in the warm coastal waters of the Gulf Coast, and it's already claimed 8 lives this year. Health officials across 4 states, Florida, Louisiana, Alabama, and Mississippi, have confirmed a total of 32 infections from what is commonly known as a flesh-eating bacteria. The culprit is a microscopic organism named Vibrio vulnificus, one of several species in the Vibrio family. These bacteria flourish in warm saltwater environments and can also concentrate in the bodies of raw shellfish, particularly oysters, which filter large volumes of water. Louisiana, in particular, is facing a deeply concerning situation. The state's Department of Health reported on Thursday that both the number of infections and resulting deaths are unusually high. With 17 cases and 4 fatalities recorded so far this year, the numbers are already outpacing the annual average of just 13 cases seen over the past decade. And this is the part most people miss. A staggering 75% of these infections weren't from eating contaminated food, but simply from exposure to seawater. Florida is also grappling with this threat, reporting 13 infections and 4 deaths. The Sunshine State has long been a hotspot for Vibrio vulnificus. In 2022, an unprecedented surge saw 74 people infected and 17 deaths, an event officials linked directly to the aftermath of Hurricane Ian, which churned up coastal sediment and pushed bacteria-filled floodwaters far inland. Meanwhile, Mississippi and Alabama have each reported a single non-fatal case this year. So how does a swim in the ocean lead to such a devastating outcome? The bacteria typically enter the body through an open wound. This could be anything from a recent surgical incision to a small cut or even a fresh tattoo. Once inside, some Vibrio vulnificus infections can rapidly progress to necrotizing fasciitis. This is where the gruesome flesh-eating moniker comes from. The bacteria release toxins that destroy the soft tissue surrounding the wound, killing it off at an alarming rate. The other primary route of infection is by consuming raw or undercooked seafood, which can lead to severe gastrointestinal symptoms like diarrhea, stomach cramps, and vomiting, along with fever and chills. According to the Centers for Disease Control and Prevention, CDC, the statistics are grim. Roughly 1 in 5 people who contract a Vibrio vulnificus infection do not survive. For those who do, the battle is often far from over, with many requiring emergency surgery or limb amputations to stop the infection spread. But here's where the conversation gets controversial. Many scientists and public health experts believe this isn't a random spike, but part of